And welcome back to the show. Pediatric asthma prevalence rates in the Bronx children far exceed national pediatric rates. Bronx children are twice as likely to be hospitalized for asthma and are more likely to die of asthma than children living in other states. Healthfirst is holding an asthma awareness town hall to better inform patients as well as their families. Joining us now to share a little bit more is Healthfirst Pediatrics Medical Director, Dr. Maja Castillo. And then we have the Vice President of Community Engagement at Healthfirst Foundation at Healthfirst, Miguel Centeno. Welcome both to the show and glad to have you here.
All right, thanks, Daren. Pleasure to be on.
Glad to have you. Well, I'll start off first with you, Dr. Castillo. Share with us a little bit about pediatric asthma. How is that defined?
So this is the really difficult part, is that people think that pediatric asthma is easy to define or is easy to diagnose. And that, in fact, isn't true. There's no one specific test for asthma. It really is defined by a series of symptoms that occur over time. And then there are some tests that we can do to help diagnose. But in general, it is a diagnosis that is what we call clinical, meaning that you have to put the pieces together.
And so when we talk about pediatric asthma, signs, symptoms, sometimes very easy to figure out, sometimes not so easy to figure out. Talk to us about the signs and the symptoms.
Absolutely. So people generally think of asthma as being wheezing, coughing, the chest being tight, kids having shortness of breath. And those are the classic symptoms of asthma. But what I think is really important for parents to know is that asthma can actually present in other ways as well. For example, in very small children, their lungs are little and you often can't hear the wheezing. And so what I would always explain to parents is you have to watch your child's breathing. Many times the only way you'll be able to tell if they're having asthma is their chest will be heaving out and in, their belly will be moving. And when asthma is really worrisome, children actually sit very still and don't even want to talk because they're having such trouble breathing. Color of skin, looking for paleness of the skin, paleness of the lips. Those are other symptoms that you often see in children that people don't necessarily relate with asthma.
Miguel, I know that there's a special town hall meeting that's being held, obviously to bring awareness to this. Talk to us about the town hall.
Yeah, absolutely, Daren. We are very excited to be able to bring this to residents of the Bronx. You know, as the largest not-for-profit health insurer in New York, that's also very, very focused on the community. We have our pulse on what's happening in the Bronx, and we know that this is a tremendous challenge to Bronx families. And so we're very excited on May 27th from 3:30 to 4:30 to bring a community town hall in partnership with the American Lung Association and also the Pediatric Asthma Center of the Children's Hospital at Montefiore, which, by the way, we're very proud to have as one of our hospital sponsors. So people are going to walk away with amazing information, and it's all absolutely free.
Free is good, and free information
is very good.
Free information will always go a long way. That's part of why we're doing this interview, to get some free information out. And Dr. Maja, tell me a little bit more about triggers, because what are some of the triggers that cause asthma?
There are many things that can cause asthma. So, for example, many children actually have a genetic predisposition, meaning that if they have parents with asthma, they can actually carry in their genes that they could be likely to develop asthma. And then asthma could be triggered in childhood by allergies, so pollens, also indoor allergies, allergies to molds, cockroaches, and animals. Cats and dogs, your pets in your home could trigger asthma. Air pollution triggers asthma, and also strong chemicals. So even cleaning products, things you could be using in your home, could be triggering asthma.
Miguel, it's important to get the message out to people and that people find out more information about this. In your line of work, talk to me a little bit about receptivity. How receptive are people to this conversation and really talking about a very special matter.
Yeah, no, absolutely. We find that people are really hungry for this information because it really is a quality of life issue, right? When you're dealing with pediatric asthma, you're looking at uh, higher than usual school absences. We're looking at ER visits, right? And so we're looking at serious impediments to people having the quality of life that they deserve. And so, we're pleased and honored to be able to help folks to have a better quality of life.
Yeah. And Dr. Maya, speaking of help, what are the treatment options that are available for people who have asthma?
There are so many treatment options now. This has really changed over the last few years. In the past, people thought that they could just use an inhaler to get rid of symptoms in the moment, but there are actually now controller medications that are in an inhaler form that, if the child takes them every day, can prevent them from having symptoms. Additionally, if the child is triggered by allergies, the allergies can be treated both by medications as well as what we call immunotherapy, where the child is actually taught, their body is taught to not react to those allergens. And now we even have medications that can help those kids that have genetic causes for their asthma. There are medications called biologics that are working very well for these kids. So it's really important that if a child has asthma that's not being controlled well with just that pump, that they see a specialist like an allergist or a pulmonologist so that they can really have diagnosed whether they need one of these more advanced treatment options.
Great to hear there's a lot of treatment options available and progression in the field of asthma. And I want to talk a little bit more about some of the work that's going on in terms of your partnerships. There's a partnership with Montefiore's Asthma Center as well as the American Lung Association.
Absolutely. To share information with people, it takes a village, right? And so we want to make sure that we have all of the relevant resources that we can bring to bear to make folks' lives easier, right? And so we're very proud of our collaboration and very much looking forward to sharing this information with as many people as possible.
Yeah, collaboration is definitely key in terms of spreading the message and getting the word out. Any anticipation on type of crowd that you're anticipating to see?
Yeah, we've done a very broad outreach to faith-based organizations, to schools, right? Any number of organizations where we feel that we can reach people who are dealing with this issue, right? And so we expect a very good turnout, and we very much look forward to people receiving information that in many ways can be life-changing and life-saving, right? So we're very privileged to be able to share this information.
Dr. Meyer, before we close, I want to talk a little bit about myths and stigmas that are associated with asthma. We hear a lot of different conjecture and people have a lot of different opinions, but what are some of those myths or stigmas that we can kind of like debunk right here?
I think for me, the most important myths to address are the myths around treatment. So many people think that the medications are addictive or that their children will need these medications forever if they start giving them. And actually, the opposite is true. The medications prevent the lungs from becoming inflamed. And so with that, the lungs are actually allowed to heal, and the child will probably need less medication in the future and maybe even grow out of their asthma. However, if the child is not treated, they may go on to develop permanent lung damage and lifelong asthma. So I think that's the number one myth I'd like to dispel. The treatments are not only not addictive, they actually will prevent the child from continuing to need medication in the future.
Dr. Maja Castillo, as well as Miguel Centeno, thank you so much for joining us here on Open, sharing about a very important topic, childhood asthma. Thanks much.
All right.
Thank you.
Thanks, Daren.
Alrighty, now, if you want more information, always, you can go to visit them at their website. The website is healthfirst.org, or you can visit them on social media at Healthfirst NY. Why don't you stay with us? We do have more show coming up. Open continue right after this.